Hi, welcome to Healthy Living. I'm Debbie Lyons. I'm here today, as always, with Kelly Presnell, Director of PR and Marketing. Thank you so much for joining us.
Glad
it's always
to be here.
A treat. This is a special day for us.
Today we have our CEO, Mark O'Neill, on. He's going to talk about the hospital and his first year as the CEO for the hospital and for our system, which includes Coastal Carolina Hospital and the Bluffton Okeechobee Outpatient Center.
There's a lot we're going to learn today. We're going to talk a little bit about his first year, kind of goals, expectations, some of the great products and services that you're offering. We're really excited to have him.
Yeah, and the other thing that we really encourage our viewers to let us know their feedback. We're very open to suggestions, your feedback. We have on our website, we have a spotlight with Mark that, you know, it's a direct email for questions to him or comments. You know, we want to hear about it. And we do get positive feedback.
Oh, yeah.
And we encourage people to send us that.
Well, I know he's always said the goal is to be very transparent, and there's no question that you can't ask, which is great.
And that's right. And that's why we encourage these opportunities, you know, to get feedback from the viewers and from the community at large. We've got we have great colleagues. Our physicians are wonderful. You know, we're constantly adding new services as it fits the needs of our community. And that's very important to us, as well as the outreach that we do in the community for prevention and wellness.
And this is a great forum to get your questions answered. If you have them, please don't hesitate.
Yeah.
Well, I'm excited. Let's talk to Mr. Mark O'Neill.
Great.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
We are here with Mark O'Neill, CEO of the hospital, and we're very excited to talk with you. A year has transpired. I can't believe it since we last talked, and we were very anxious to capture you and allow you the opportunity to come and sit down and chat about your past year and now the year going forward. So thank you very much for joining us today.
Oh, I'm more than happy to be here.
Let's talk, if we can, a little bit about when you got here, the expectations that you had, how you're feeling about those expectations today.
Sure. I got to tell you that after the first year, most of the expectations I had are right on. It's been very good for us, both in terms of our enculturation in the community as well as the job here at Hilton Head Hospital. I think we talked last time. I had done a lot of research about the hospital.
Yes.
And so there were things that I knew when I came here that didn't surprised me at all when I got here, and we worked them through, and it's been a very successful, busy but successful first year.
Let me ask you this, just from a philosophy point of view. When you come into a situation like this, you do research, and then do you have to take some time, or do you take time to really acclimate yourself to the environment?
Sure. Every organization has a different culture, and as a new leader, the first thing you want to do is listen and learn both the history and the current situation. So the first 2 or 3 months, I stayed internal, although there's lots of work to do in the community. Stayed internal, learned the history of the organization, the culture, and its people, and now you're ready to kind of move on.
Talking about culture then, let's talk, if we can, a little bit about the culture that was at the hospital, and now how culture is shifting more toward your leadership style.
Well, I'm not sure there's a heck of a lot of difference in the cultures, because it all really does go back to the vision of those that started this hospital. When you think of the Lamonts and the Bethets and those folks that said, if we're going to have a world-class destination as an island, then we need good health care here. And that's been the effort right from the beginning. What we might have done in the last year is just focus in on that and really try to define what we mean by world-class, what we mean by excellent, learn the systems, and then set a direction for the future that's around a vision that is explicit about we're going to be a great place for our employees to work, we're going to be a great place for physicians to practice medicine, and if we're those two things, we're going to be a great place for patients to receive care.
Does the hospital still have a vision statement?
Yes, and I just gave it to you.
Again.
We want to be a great place
Okay.
for colleagues to work, a great place for physicians to practice medicine, and therefore a great place for patients to receive care.
What makes a hospital have a high standard or high quality of care?
Sure. I think that does go back to some of the culture. If you're talking about being a great place, then you're going to be very obsessive about looking for opportunities to improve. We're a learning organization, and we've said 100 times that the only problem that we have is the one that we don't know about. So we're really transparent internally when we have something go wrong. We talk about it. We figure out what we're going to do about it. If we don't have the answer here, we go find the answer, bring it back, and implement it. That's another good thing about the people that we have working here. They're from all over the country. They've worked in great places, and they have great experiences that they bring to the table.
So you have a lot of diversity and bring that into the equation.
Absolutely. Every orientation session is a lot of fun because you can talk about where they're from, what their history is, what their experience is. And when you can bring that all together, you can learn a lot in a learning organization.
Oh my gosh. So in addition to doing things internally now, you are extending out into the community.
Yeah.
Are you enjoying that part of your
Absolutely.
job too?
Yeah, actually it's a great change from my last job where I spent a lot of time on an airplane. Being able to get reconnected with the community, especially for a hospital like this where there's no separation between the people who work here and the people who get care here. We're
Absolutely.
We're all part of the same community.
Do people come to you with questions that there are patterns or themes to that you address quite often?
Well, you know, one of the things that goes on here with the questions is, what about all this healthcare reform? And
Okay.
what is our future like, and what are the changes? And yes, I get a lot of that, and I think I wish the answers to all of that were as clear as we'd like it to be. But the real point is, if you do provide that great patient care with good service and make sure you have quality and safety at the top of your mind all the time, it's not really going to matter what happens in the future. You'll be successful by doing that because that's our mission.
So it's basically take it a day at a time.
Yeah, on that part of it, take it a patient at a time
Okay.
and an interaction at a time with the patient. Now, you do have to have a long-term view of things and where you think you want to go as an organization, but it starts with that very last patient that came in our door
And I
for
think
the service that we need.
That's interesting conceptually to me because I feel as though the hospital is very patient-centric, if you will, very patient-oriented. But like you said, and I think what you're alluding to is really leadership begins with you and trickles down. So that's how it sort of all comes together at the end of the road, that the patient is really the core.
Yeah, if I were to draw an organizational chart, it would be with the patient at the top.
Oh, okay.
And all of us at the bottom. Because
Okay.
that's really what we're trying to do. All of the organization is supposed to be aimed, now we drop the ball every once in a while, but it's supposed to be aimed at the satisfaction of the patient, and most importantly, the quality and the safety of the care that we provide.
I love how you're doing that. My whole mindset just sort of my whole paradigm did that shift.
Sure.
Okay, and that makes a lot of sense to me. Is it about education? Is it about our staff? Is it about staying current? Are those a lot of the things that you really work toward?
Yeah, you can't just state that you're a learning organization. You have to be committed to the professional development of our team, to always keeping your eye open for what's going on out there in the rest of the country and finding the best practice and working together to bring that here. So the minute you stop learning, you stop growing.
Is medicine and running a hospital a collaborative kind of endeavor?
It is here. I can tell you that that's been one of my most pleasant surprises. We have a top-notch medical staff here. The physicians are, I know you've had many on the show,
absolutely.
So I couldn't go through all of them, but they are very well trained, very well credentialed, with our board's vision of nobody's here that's not board certified. So you have a great medical staff, and I've found it very collaborative. We've had lots of difficult issues we've worked through together. The medical staff leadership is wonderful in terms of working together.
And the other thing that I've heard from your team, because I mean, being out in the community, we hear things, but also being fortunate enough to be sort of part of the periphery of the hospital family, if you will. I get to talk a lot to the nurses and other ancillary people here, and they seem to be really excited about the, again, the collaboration or the team approach that you all are doing so well.
Sure.
In other words, the nurses feel it's this being supported by everyone.
Yeah, I think if any one of us thinks we have all the answers, then
Wrong
we're in
answer,
trouble,
right? Yeah.
So our spine program that we just started
Exactly.
would be a perfect example of what you're talking about. The physicians didn't just say, here's how it's going to be. They worked with our nursing staff, with our operating room staff, with the patient units, and they designed a program that was patient-centered and a function of their experience in doing spine surgery. And that's the way we like to do it. Pull everybody in a room, figure out what it is you want to do and how you want to do it, and then go ahead and execute.
Do you take assessments as to the needs of the community also? Is our demographic such that we look for disease processes that would happen in an older population, or do we have to be more diverse?
Yeah, we do a lot of community assessment and look at what the mix of physicians are to take care of the types of patients by age and demographic here. And it's quite an interesting mix, as you know. We've got the retirement population, we've got the working population. So you're always looking for what that unmet community need is. And it's not always within the four walls of the hospital. We do a lot of prevention and education, outreach, and those sorts of things as part of our mission.
I think the hospital is very well thought of out in the community as being a source of a lot of answer giving, if you will. We're going to take a quick break. We're going to take a quick break here on Healthy Living. We're going to come back. We've got lots more questions for Mark O'Neill. Thank you for joining us. We'll be right back.
We were outside after dinner. Mary Grace was riding her bike and heard a scream that no mother wants to hear. We took her immediately to Coastal Carolina. We could not believe it was a broken jaw. They are gifted to do what they do, and they are there for the community. And as a member of the community, I will be forever grateful.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
We went to the emergency room, and thank heavens we did.
They discovered that I had 2 totally blocked arteries, and I ended up having double bypass open heart surgery. Well, I stayed in the hospital for just a few nights.
To the staff at Hilton Head Hospital, I would express the deepest gratitude that I possess. They literally, quite literally, saved my wife's life.
We are back here on Healthy Living. We are talking with the CEO, Mark O'Neill. And it's fun to talk to you. It really is. And I think what makes it so fun and is that you seem very accessible, number one. And, you know, as always, when we take breaks, we say, oh, you know, I want to ask you these questions, or what do you think about that? And basically it's like, ask away.
Sure.
And that's kind of a nice, it's a very nice place to be in, and hopefully on both sides. And one of the things that I'm curious about and interested in is Tenet owns our hospital, and I hear wonderful things about that, and I have questions about that. Help me, and this is your first experience, I think, with a for-profit hospital also.
Yeah, I've been blessed in terms of my career. I've had 10 years in academic medicine, 15 years in not-for-profit, community-owned medicine, and then another 10 years in Catholic healthcare or faith-based healthcare. So I've really been blessed with being able to be in each component, and I was interested to see what the difference would be with my first year in the for-profit medicine. not to disappoint you at all.
Yeah, exactly.
but
Actually, I wasn't hoping to be disappointed. I was hoping to be thrilled.
But I am finding that the difference is very small.
Okay.
There are some differences, obviously, with the for-profit mentality. But if you go back to what we were talking about, it's all about the people that are taking care of patients.
Okay,
now,
true.
The way you've structured yourself around that effort, there are some differences. Having said that, with a for-profit organization, a hospital this size that has the scope of services that it has needs tremendous amount of financial support, capital equipment, the development of information technology, the ability to purchase as 50 hospitals instead of one hospital. All of that drives value back to the community. So the good part, the pros of a for-profit environment is that you have somebody to fall back on when you need capital support. If we were to develop an information system here, it would cost many, many millions of dollars. If it's done once for 50 hospitals, it's obviously a lot less
Actually,
expensive.
point well taken. I don't think of it, I think, in that terms of the fact that we probably have the best equipment. We have things because we have large buying power is what you're saying, really.
Right. And as I understand it, that's why the community turned to Tenet to begin with, because that capital shortage was so stressful in terms of the future of the organization that we've had some success with that.
Does it also impact our ability to hire top-notch physicians if they're used to doing cutting-edge procedures?
Yeah, technology is one of the things they ask you about. They ask you about the patient base and who they would be taking care of and all of that. But the other thing that helps us with physicians and nurses is once somebody in one of those 50 hospitals learns a lesson, we spread those best practices around, and so we're able to learn from each other, and we've got a lot of standardization going on.
Okay.
You find out what the best way to do a certain procedure is. You work with the physicians, and you implement it according to something that's more standardized. It used to be, well, whatever we do in our community, we do in our community.
Exactly.
And that doesn't necessarily guarantee the best medical practice.
Totally on an aside, I just read a book called Complications, which speaks to that. It talks about you want the person who's done it. You want that standardization when you're treating people.
Sure.
I mean, it makes a lot of sense. From a product and services point of view, what are some of the things, you've mentioned the Spine Institute,
Right.
what are some of the other products and services that you're offering that you're excited about growing and that are here now?
Sure. There's so many.
Yeah,
and
there
somebody's
are.
going to say you missed me.
Yeah,
But,
yeah.
but in terms of our cardiac program, the work that we do with the EMS community, the STEMI program, diagnosing in the field, and then getting somebody to the treatment they need in a very short period of time.
Code STEMI.
That's right,
Love
code
it.
STEMI,
Yes.
right. And of course, doctors like Dr. Castle are top-notch cardiac surgeons at one end of that chain. Our women's services, both our maternal and child health services, as well as our breast surgeon, who I know you, Dr. Herman, that you've had on.
Yes.
Of course, the spine surgeons. I think a well-kept secret for us are both our oncologist, Dr. Thomas, as well as our 3 general surgeons who are past award-winning surgeons when it comes to GI surgery. So pretty much across the board, we have the best in terms of the services that we provide.
Are we thought of as a broad-spectrum hospital with broad-spectrum services?
For the size of this hospital, we're a very broad-spectrum scope of services. What we've done in the last year to refine this, though, is have significant discussions with ourselves about if we can't do it well here, we're not going to do it.
Okay.
So we have things like pediatrics, that people would love us to have a pediatric unit, but we don't have enough pediatric patients that we could assure the community quality care, or neonatal intensive care, or trauma. And in any of those cases where we can't provide those kinds of services, our focus has been on finding the institution to affiliate with for those services and really streamlining the process of getting the patient there. So,
But that should make me proud. That should be what I want, the right answer, isn't it?
Sure. Our relationship with MUSC would be a good example. If we can't do it here, we've got all sorts of referral arrangements, expedited referral process, and the rest that works very well.
Let me ask you about Hilton Head Hospital is a system, really. It's not just this entity.
Right.
What are you doing out in there's a stroke center?
There's a stroke
Coastal?
center at Coastal Carolina
Yep.
Hospital, and Coastal Carolina has done excellent work over the last year or so with Bill Masterton leading it. We've worked together in terms of what services do we provide there, what ones do we provide here. And of course, we're developing all sorts of things in the Bluffton-Okatee area on an outpatient basis so that we can make decisions there about what's the best place for a patient to receive care. Is it coastal or is it here?
So interesting, it really is. Other things that you are doing out in the community, as far as product and services.
Okay. Well, all of the screening services that we do, whether it's vascular screening or cardiac screening or
okay, vascular screening, cardiac screening, yes,
right, the education programs, anything that has to do with cancer or heart, we're always there because we want to be able to be part of the education picture. All of our outreach activities, gosh, there's just a whole list of them.
Why is outreach so important?
Well, because you can't take your mission seriously about improving the health of the population
unless you
if
go
all
out
you're
in
going
the
to do
field.
is take care of them when they're sick. And we take very seriously and spend a lot of time from the high schools to the community sessions that we do to try to prevent the very diseases we're taking care of.
And I think that leads me really to another personal question. I think one of the things I've been impressed about and notice all the time from talking to Kelly and everyone around is a focus on prevention. And getting well, staying healthy and well within your own community.
Right.
And I don't mean Hilton Head, I mean within your hospital community.
Right.
I can't tell you how many steps I've walked and
Well, we all I
practicing
don't have my
what
pedometer
we're
with me today,
you
but we all
too.
have one, right? Right.
But practicing what you're saying is important.
Sure.
Is there a focus then on prevention also?
There really, within the workforce, yes. I mean, we just opened our cardiac rehab unit as a quasi-athletic center for our colleagues that want to use it in the off hours or during their breaks.
Oh, so cardiac rehab, now we can go down and get on the
It's now
treadmill.
CEO rehab. too.
Yeah, CEO rehab. Take a mental break.
Right.
What are you excited about, or what do you see for the next, let's say, 6 months, a year, 5 years? What are your hopes?
I think in the next 6 months to a year, we'll continue to focus on the execution of that vision. We want perfect satisfaction at all three levels, at the colleague or employee level, at the physician level, and at the patient level. So with every time someone comes through the door, we're going to focus on that. Now that might seem internal, but that's what our strategic differentiation wants to be. People in this community, we want them to believe that when they come here, they're safe and they'll be served well. That's the focus still as we get started. Longer term, we want to make sure that those programs I mentioned to you, they're all very, very good, but not as deep as we'd like them.
Okay.
So we'll be looking to grow them.
More robust, if you will.
Right. As the population grows,
Okay.
as the population ages.
The depth and breadth of those will
That's right.
Okay.
We're about where we want to be breadth-wise. I don't
Okay.
anticipate doing a lot more.
Okay,
of the
that way, but-
esoteric,
okay.
but in terms of having second and third physicians that are really good, like the first level and the second level, that's what we're going to work on.
You are absolutely mesmerizing to talk to, simply because not only do you state the answers, but you present and build a very powerful case. So it's really interesting, and we feel very fortunate that you come on. We'd love to talk with you more. Appreciate it very much. We want to thank you all for joining us here on Healthy Living. Bye-bye.